The following program contains mature subject matter. Viewer discretion is advised. Support for this program is provided by the Foundation for Excellence in Louisiana Public Broadcasting.
Hello and welcome to Louisiana Public Square. I'm Beth Courtney, President of Louisiana Public Broadcasting.
And I'm Kirby Goodell, Director of LSU's Public Policy Research Lab. Over 30 years ago, the first AIDS virus was detected in the United States. In 1979, the first Louisiana resident with AIDS was diagnosed. At the time, it was considered a gay white man's disease. While men having sex with men still accounts for the majority of the new diagnoses, HIV and AIDS have crossed the barriers of sexual orientation, race, and gender. Even infants risk contracting AIDS from an infected mother's breast milk.
Well, in Louisiana, the rates for HIV/AIDS are extremely high. Baton Rouge and New Orleans rank second and third nationally for new HIV diagnoses. For new AIDS cases, Baton Rouge ranks first. Blacks in Louisiana are disproportionately affected. Their HIV rate is 7 times higher than that of whites. And among Louisiana's youth, 13 to 24-year-olds account for a quarter of new cases. So how is Louisiana confronting this health crisis? Tonight, we explore preventing HIV/AIDS in Louisiana.
On February 7th, Southern University students gathered on the Baton Rouge campus for National Black HIV/AIDS Awareness Day. The annual event is an opportunity to promote HIV prevention among African Americans who are disproportionately affected both at the national and state levels by the virus. Christy Perry was one of the organizers.
When we look at the rates and we look at the statistics, we see that among the newer cases, we see a larger increase in those numbers. So it's very important that African Americans are getting the information, getting the knowledge that they need to protect themselves.
According to a 2010 report by the Louisiana Department of Health and Hospitals, 73% of newly diagnosed HIV cases and 76% of newly diagnosed AIDS cases in Louisiana were among African Americans. Over 60% of all new HIV diagnoses among blacks are in New Orleans and Baton Rouge. Shreveport has the third highest number.
African Americans tend to get tested later than any other race. Therefore, they get diagnosed later, and then they start their treatment later, which isn't good for their immune system.
Leah Cullens is on the faculty of Southern's School of Nursing and is a member of the Governor's Commission on HIV. She says when HIV-positive individuals delay getting tested, they risk infecting others as well as allowing the virus to progress into AIDS. Cullens feels that fear and ignorance about HIV prevent people from taking that first step.
Some people have misconceptions by if I kiss a person with HIV, I'm going to acquire HIV, or I'm going to get infected with HIV. If I touch a person with HIV, that's impossible. Yeah. And that's like a big stigma in our community. A person that's HIV, I don't want to deal with them. I don't want to be around them.
I didn't want anybody to know. The people in my church at the time wouldn't even sit on the same pew with me.
Millicent Foster has been living with HIV since 2002. Despite early rejection from acquaintances, she has received constant support from her immediate family. Millicent admits her lack of knowledge about the virus had her bewildered when she received her diagnosis.
Never had a blood transfusion. I'm not gay. I don't shoot up drugs. How could this happen to me?
Though Millicent didn't use needles, she did use drugs. She also often had unprotected sex, one of the primary ways for the virus to spread, according to Ashanti Lagarde with Family Services of Greater Baton Rouge.
There's 4 ways that you can catch it, and that's blood, semen, vaginal secretions, IV drug use, just sharing needles. And now we found out that you can catch HIV from breast milk. So a mother can pass HIV on to her infant.
So why are Louisiana's rates so high? A study by the group Human Rights Watch indicates nearly half of people in the U.S. with HIV or AIDS reside in southern states, despite just housing 36% of the country's population. In addition to poverty and lack of access to health care, the report attributes the high rates to policies in the South, such as Louisiana's abstinence-centered sex education.
In response to those who say that we truly need to teach the use of condoms and how to properly be able to address that issue, it's a countercultural viewpoint to the church's viewpoint, certainly. And what I would suggest is, while the church's viewpoint is certainly more challenging, that we raise the bar.
Rob Tassman is the Associate Director of the Louisiana Conference of Catholic Bishops, also known as LCCB. The group was one of the opponents to a comprehensive sex education bill proposed last legislative session by Democratic Representative Pat Smith from Baton Rouge. The LCCB advocates celibacy and monogamy as the healthiest ways to avoid HIV infection.
As a preventative measure to the spread of sexually transmitted diseases and things of that nature, the bishops and the church at large would promote an increased sense of fidelity and chastity. And if you put those two together, you create very healthy relationships.
Let's not just keep focusing on wait till you get married. Don't have sex until you're married. Remain abstinent, because that's a wonderful idea. But in reality, it's not reality.
Cullens, herself a Catholic, feels that for the sake of those students who are having sex, it's important to teach them how to properly use condoms. She also supports needle exchange programs for intravenous drug users.
They're going to use the drugs regardless because it's an addiction. Well, you're condoning their drug use. No, we're condoning them living.
In Louisiana, 16% of people who are diagnosed as HIV positive are IV drug users. In 2010, President Barack Obama unveiled the National HIV/AIDS Strategy. Still in place today, the targeted goals include reducing HIV, increasing access to health care, and reducing HIV-related health disparities. The strategy relies heavily on the expansion of Medicaid made available through the Affordable Care Act. Louisiana is currently one of 13 states opting out of the expansion. Governor Bobby Jindal says it would cost the state nearly $4 billion over the next 10 years. But according to the Louisiana Budget Project, if Louisiana participated in the Medicaid expansion, the state would receive $15.8 billion in federal support over 10 years. Whether it's more funding or different education policies, there is one thing that everyone can agree on. Louisiana's high HIV and AIDS rates need to be reduced. One step toward lowering the numbers is to know your status. Millicent is the first to admit that deciding to get tested isn't easy.
It's hard because a lot of people feel like I was, like they don't fit in that category, but my thing is, if you've ever had unprotected sex, you need to be tested.
And if you are positive,
don't look at HIV as being a death sentence. Just look at it as a new way of living. If we come together as a community and just pitch in together and educate everybody and erase this stigma, our next generation won't have to live with this because it can be ended. HIV is preventable.
Joining us in our studio to discuss HIV/AIDS in Louisiana are residents from the greater Baton Rouge area. We're also joined by members of the Legislative Youth Advisory Council. Welcome, everyone. LSU's Public Policy Research Lab surveyed over 100 citizens on tonight's topic. Among the survey responses, when asked why they think Baton Rouge's AIDS rates are so high, the top three answers chosen were poor sex education at 38%, lack of access to quality health care at 13%, and inadequate HIV testing at 10%. While Louisiana doesn't require sex education in public schools, when it is taught, it must be abstinence-centered. Of those surveyed, 61% supported this approach, 30% opposed it, and a total of 9% refused to answer or were unsure. Yet, despite the significant support for current abstinence-only sex education, an even larger percentage, 72, would support a more comprehensive approach. 22% would not, and a total of 6% refused to answer or were unsure. And when asked their concern about their friends or themselves being personally infected with the HIV virus, respondents were nearly evenly split in their responses. A total of 53% of respondents were somewhat or very concerned, while a total of 47% were not too or not at all concerned. So, why are HIV/AIDS rates so high in Baton Rouge?
I would say because people don't think it could happen to them. I've been living with HIV for 12 years, and I didn't think it could happen to me either. I was misdiagnosed for 2 years with Sjogren's syndrome, which is also an autoimmune deficiency. But I started having all these symptoms, flu-like symptoms, losing weight, and went to the doctor, and his thing was, you could just lose some weight. It's no problem. Well, I'm still getting sick. I'm not getting better. If people know beforehand, by the time I was diagnosed, I was knocking on the door of AIDS. Today, thank God, the virus is undetectable, and my CD4 count is 2140, which is above normal. So I'm healthy. And I thank God for just allowing me to be here to even share my story, to tell people, don't be afraid, know your status, get tested.
Is that it? Is it testing? Is it knowledge? Tiffany?
I also think a big part of that is that you didn't know what the symptoms were. Your doctors weren't sure. I think that has a big part to play in the education. I think that students in Louisiana have a right to be educated about this. It deals with education, with healthcare in Louisiana. Healthcare is a big problem, how we're going to pay for things. I believe that if we really target young people, teach them these things, it's something that needs to be known.
Well, we have some students from the Youth Advisory Council, so tell me, what do we need? What are you learning about AIDS and HIV, and do you feel like you know enough? Josh?
I don't feel like we're learning enough. I feel like there is some education towards like sexual education, but I don't feel like it's enough focused on sexual diseases and where to go to get tested or how to get tested or who to talk to, and I think that's a big problem.
Do people know where they would go to get tested? Testing seems to be a big issue. Does everyone know?
Well, the thing is, I don't think that many people know where to go. I think knowledge is power. Amen. And when I advocate abstinence, but not abstinence in a vacuum. If I'm going to tell you not to do something, then I need you to know what you need to do. So knowledge is very important. Ignorance of what to do is a big factor in why the cases are so high.
Okay. Is the answer in the school system then? If it's education, is it the school system or is it something outside the school system? Charlotte?
Well, I think that the younger the students are, and I know we are concerned about the age of our students, when should these kids or the young people get the information concerning AIDS? And generally, we're looking at AIDS starting at age 13, 12 and 13. So to get that information into the classrooms, we don't like to talk about a subject like that, but AIDS education is very important to our young people starting at 13, and that continues on through their young adult life.
To piggyback off of Cassandra, my thing is we've been asked to come to the schools in the areas, even in the rural areas. When the school calls us, we come because we have a program that is designed to be able to, as my boss says, keep it real with the children. And when you have elementary school, children and the teachers doing acts at the school. So when you say 13, and like she said, at 10, 9 and 10, they're doing the acts. So the thing is, it's not really... it has a lot to do with the parents because, as you said, Charlotte, the parents don't want to talk and touch on that touchy subject. So the thing is, in giving us the okay, and if the school allows us, then we come in and we bring that education to the school system.
Natalie.
Yeah, you were mentioning about if we should only focus on schools and the age range, but I think it should start in schools, but also venture out, because you want to talk to them at a young age, but also go into our churches, go to where people are. You have to meet people where they are. So go to where people are, go to gay bars, to talk to people in general about HIV and AIDS, so we'll know.
And if I may comment, the face of AIDS and HIV has changed. I am a 31-year survivor, and I say God bless. And because of the education factor and the compliance of and being steadfast and sticking to the regimen and things of this sort, I'm surviving, and people are living longer. And as I said, it's the face of HIV has changed. I mean, of course, when it started out, it was supposed to have been a gay man's disease. Sure. Now it's affecting everybody. You know, anybody can have this this disease.
It's always best to know rather than not know.
Mm-hmm. Yeah, Millicent, you talked about a stigma.
Yeah, well, I look at it like this. The stigma is so bad because majority of the time when they talk about HIV and AIDS, they're still portraying a death sentence. And a lot of people don't understand that it is no longer a death sentence. You can live a very long, very healthy, very productive life. You know, and also I think another part of the stigma is because we don't have enough positive people that's willing to stand up and put a face behind this saying, I am a survivor, I can make it. Anything you want to do, you can do it. But you got to have that faith first.
And so therefore, in Louisiana, then, I'm listening to what all of you are saying, is that we need to create a climate for change.
Exactly.
We're not moving with the change. The home needs to be included, the school, the church. So if we're touching those areas, we ought to be able to reach someone with this information that we're hearing today.
Yes,
I would just
Lysandra.
like to say, as I'm a peer educator at Southern University for AIDS and HIV awareness, I did a presentation yesterday on AIDS and HIV. I showed the students how to correctly put on a condom. I told them that, you know, you have to know your status. You have to go out and get tested, because these diseases and these viruses, they don't have symptoms all the time. So the only way you can go about knowing about AIDS and HIV is going out and get tested and being educated on the subject itself.
Should we make testing mandatory? We need testing.
Well, it is now. I think women can be tested when you have your physical now, because 12 years ago, I was tested for everything except HIV.
But I don't think it's mandatory. The thing is, you ask. You have to. All the rest of them you can take, but you have to ask for an HIV test, because there's a little bit more that has to be done. Because if you're pregnant, they're going to do all the other tests for you. But because, if, like you said, I didn't pose a risk, I didn't look like that face. So the thing is, the doctors just, okay, that's why you were misdiagnosed, because you didn't have that face that looked like somebody that has HIV.
Charlotte.
And you know, that's another concern, because to have the tests readily available at different locations throughout the city in private areas where these people can actually go in and have the testing done without everybody knowing that they're having the testing, maybe some of the younger people would engage in the test more often, and we can catch this earlier. The other thing is statistics. Let the young people know they're educated. So tell them, give them the statistics, lay it out, and let them know what's happening in the communities should they not take preventive precautions.
All right, that's all the time we have for this portion of our show. When we return, we'll be joined by our panel of experts to further explore HIV and AIDS in Louisiana. Welcome back to Louisiana Public Square. Tonight we're discussing HIV and AIDS in Louisiana. Joining us now is our panel of experts. Reverend Fred Jeff Smith is the newly elected pastor of Shiloh Missionary Baptist Church in Baton Rouge. A former pastor of congregations in New Orleans and Scotlandville, Reverend Smith is also a member and past board president of the Interfaith Federation of Greater Baton Rouge. Dr. Mark Derry is an assistant professor of clinical medicine at Tulane University. He is also the medical director for the Tulane T-Cell Clinic, which serves the needs of HIV-positive clients in New Orleans, primarily women and minorities. Dr. Joyce Turner Keller is the founder of Aspirations, a nonprofit organization serving the needs of people infected with or affected by HIV/AIDS. The mother of 3, Dr. Keller has been living with HIV since November of 2001. Reverend A.J. Johnson is the founder of the Baton Rouge AIDS Society. His organization provides HIV training and testing services to over 5,000 individuals within Louisiana on an annual basis. Earlier this year, Reverend Johnson was appointed by the governor to the Louisiana Commission on HIV/AIDS. Before we go to the audience for questions, I'd like to start with you, Dr. Derry. You've done some research in the area. Can you tell us what can we do about these high infection rates in Baton Rouge?
Well, in Baton Rouge, and I'm from New Orleans. I'm at Tulane, and as you guys discussed earlier, New Orleans and Baton Rouge are number 2 and 3 in the country for new cases of HIV. And for me, in particular, my particular field of research and area of expertise with HIV is really in education. And I strongly oppose abstinence-only sexuality education. And this summer we presented data at the International AIDS Conference linking HIV directly to abstinence-only sexuality education in the Black community. That's a problem. And I was giving testimony at the Hill there, and it was very hard. I mean, I sat there, I presented my data. I pleaded, and the advocate actually did a story saying how I just pleaded and begged and said that a majority of my teens that come and see me who are 18 years old have never been talked to about sexuality education at all, or if they do, it's all lies, because we know that abstinence-only sexuality education does not work. And so we're hurting our young people, and I told that to the lawmakers, that we are hurting our young people, and we are literally killing them by teaching them lies, and presented them with very, very factual information. And the person who came up behind me presented herself. She was private citizen Jane Doe, and she said, if we have comprehensive sexuality education in the state of Louisiana, that's going to lead to sex slavery. And the lawmakers were like, oh, yes, we can't have that. And boom, Bill was killed.
Pastor Smith, from a church perspective, Fred, I'm sorry.
That's
from
okay.
a church perspective, what's sort of the response to this?
Well, first of all, I think it's important that we distinguish when we talk about the church. We speak of the church in monolithic terms, and I don't think that that's accurate. Watching your presentation earlier, you had representatives of the Roman Catholic Church. I don't remember seeing representatives of Protestant churches, Baptist churches. And one of the distinctions that I think is important is that African American Protestant and Baptist churches are not diocesan. There is not a hierarchy that speaks for every local congregation. In fact, in our communities, in our churches, each local congregation is its own sovereign, autonomous body. Mm-hmm. And so if you want to present education alternatives to abstinence only, it's important that you make the effort to get into those individual churches and speak to those individual pastors and leaders, because there's not going to be a message coming from on high that's going to speak to all of those congregations. So you have to have some understanding of how our churches operate if you expect to get cooperation from us.
Dr. Keller and Pastor Johnson, y'all are dealing with this on the ground. What's your all's take on the role of education and abstinence education? Dr. Keller?
I do not teach abstinence only. And as a minister of 46 years and having been reared in the Baptist faith, oftentimes I'm told that, well, I can't believe you're teaching sex outside of marriage. Well, if you were one of those people sitting there giving a test to a 12 or 13-year-old who tested positive, you would, want to change your perspective too. I think education is imperative. I think that just like they offer tipsy taxi to people who drink during the holidays, I think it's important that we offer life-saving tools and help teach our kids how to make healthier choices to save their lives. I'm a non-traditional minister. I grew up, like I said, in the Baptist church, but I've taken my message from the pulpit to the public because having been diagnosed with AIDS at 52 years of age, I thought AIDS had nothing to do with me. So for me, it's personal. And I have to do this. I had spent my life trying to save someone's soul. And I realized I cannot save a soul until I can save a life. So I think education is paramount. We need to really actually have more education in schools. And it should start at home, first of all. Let's put that out there. It needs to start at the kitchen table and then go into the schools.
Pastor Johnson.
Well, at Baton Rouge AIDS Society, we have a program called the FBI, and it's the faith-based initiative. And what we do is we train pastors to actually talk about this. You know, one of the things we train is with the Uganda approach. The Uganda approach is an ABC approach. Abstinence is A, be faithful, monogamous relationship is B, C, use condoms. So we don't teach pastors to talk to their congregation just about abstinence. But there are some ministers that are still doing that, and that's one of the reasons we have a problem. If a pastor talks about prosperity and how you use your finances and believe in God, members of the congregation are going to start believing that they need to focus on prosperity. Mm-hmm. If the pastor talks about condom use and you can't just have sex with anybody nowadays, members of the congregation are going to stop trying to have sex with everybody without protecting themselves. So we need to get to the level where we are talking about this on a regular basis. If you drop water on concrete, it's not going to do anything. But if you keep dropping water in the same spot, water can break concrete. We can break these numbers if we keep talking about it, not just one Sunday. And we have enough days throughout the year that recognize World AIDS Day, African American HIV/AIDS Awareness Day, National Latino HIV/AIDS Awareness Day, Women and Girls HIV/AIDS Awareness Day, National Testing Day. We got days throughout the year. If they just talked about it on those days, we would make a breakthrough.
Let's turn to the audience. Questions. Monique, you had a question about changing AIDS rates.
Well, I actually like to direct my question to Dr. Derry, which will take a different approach from what you said. But is there a genetic difference that makes African Americans more susceptible to the HIV/AIDS virus? Or is it purely a result of behavior? Are you aware of that with your studies?
Yeah. Actually, that's part of the studies I'm doing. I don't think that there's a genetic predisposition for HIV in the African American community. I think that it's a combination of two factors. I call it my convenient reason and my inconvenient reason. The convenient reason, I believe that there is an increased incidence of HIV in the African American communities, especially in the South. The convenient reason, I think, is because of the abstinence-only sexuality education, and that was the data I presented in Washington, D.C., linking abstinence-only to HIV in African American communities. The inconvenient reason, I believe, has to do a significant amount with institutional racism, in that we are the #1 jailers in Louisiana, and those that are jailed the most are African Americans. And when my patients talk to me, they oftentimes will tell me, my female patients will talk to me, that there's sometimes 2, 3, 4 black women to 1 black male. And if a black male does not want to wear a condom, everybody wants to experience intimacy, so she will sometimes let her guard go. And by the time she sees me, because I'm an HIV provider, it's obviously too late. So we need to empower black women, because black women are the least empowered in our communities. The #1 killer of black women between the ages of 25 and 40 is HIV. This is a completely preventable disease, and yet it's killing black women. It's the #1 reason for death in the black community, black women. So that's what I think. I don't think there's a genetic difference. I think it's that.
Okay. Wallace, did you have a question?
Yes, sir. As we know, abstinence is a great answer, but also, what has the government done, or being that you're on the governor's council or whatever, to help show the consequences of drug use, and especially with sharing of needles, unprotected sex, and the prevention of HIV and AIDS?
Well, in our state, we still don't have a legalized needle exchange program. So there's not funding for agencies to go out there and support the prevention of the spread as far as a healthy choice. It's not saying, the argument about if I give them clean needles, I'm telling them it's okay to shoot up. That's the same argument that if I give them some condoms, I'm telling them they can go ahead and have sex. When you tell a child at the age of 4, if you cross the street, look both ways before you cross, you're not telling them, now go run out there and cross the street. You're telling them these are things you need to be conscious of for your health, for your safety. So we're not legalizing needle exchange programs because of the stigma that goes with it. Because we're going to be saying that we're supporting injection drug use. But how are we going to get people off injected drugs if they're dead? How are we going to prevent the spread of HIV if they're sharing the same needle? There are steps that you have to take to get people off addictions. And if I had the power to go and touch people and just stop spreading HIV, I wouldn't sleep. I would stay up touching people. But we're not doing that. We're not talking about that from the pulpit because that's a no-no. Baton Rouge is number 1. In 2002, we were number 2. We had billboards all over the place saying we're number 2. Well, before we became number 1, we were number 2 2 years in a row. No billboards. We don't want people to come through Baton Rouge and see we have a problem. So we're keeping it hush-hush. The Governor's Commission deals with a lot of political issues and contracts and services that are happening in the state, but we're still not addressing the real problem. I'll say it at the commission. I'll say it on TV. I'll say it on the radio. I'll say it on the news. We need to take a Katrina approach to this. We need to say, look, this has hit our community. What's our plan? We don't have a plan. We don't have a documented plan that's going to reap some type of success in our community. We're sitting around being reactive instead of proactive, and that's the biggest problem.
Is it the things we know we need to do and we're not doing, or is it things that we don't know yet we need to be doing?
Go ahead.
It's things that we need to know. I think we're doing things we need to do. What's happening is that, and I say this all the time, and I'm always screaming. I'm in D.C. screaming, I'm in Baton Rouge screaming, and I'm in the church screaming, I'm in the street screaming. Number one, I scream a lot because I feel like a lot of the agencies that are getting the funding are not in the street like they need to be. They're afraid to go in some zip codes, but they're getting funding for outreach, but that job is not being done. But there are people like me who are out there doing the work who don't get the funding. I think there's too much politics in addressing the issues of HIV. I think that one of the problems that we're facing is they say, well, we're cutting funding. Well, you're cutting funding, but there's a lot of the funding that's out there is not getting where it needs to be. And I think we're not raising enough hell in our communities about what's happening in our communities. We talk about everything but what needs to be talked about. We need to make sure that parents are involved. You know, we talk about what the system needs to do. We need to put it back to where the parents need to start talking about HIV. They need to talk about, things with their children. They need to have the kind of conversations at the kitchen table that my mother had with me. We were told that there were certain consequences for your action. And we need to get back to that. And another thing, we need to stop lying and telling children that sex is this bad thing. We need to tell the truth. Sex is good. It's real good. But we got to tell the kids that they're not emotionally ready to handle it. Economically, they cannot handle it. And socially, there are some things that you just should not do.
Our biggest problem is testing. We have, in the past 5 years, the Office of Public Health has had to cut back on agencies that provide free testing to the community. And that's not because of the Office of Public Health, that's because of statewide cuts. Baton Rouge AIDS Society was the only agency that continued to provide testing. If we follow the Center for Disease Control that says testing should be part of routine health care, but yet we cut back to places people can go and get free testing, what are we saying? Let me give you an analogy right quick. If you have a community that has 5 fire stations and a house catches on fire, that fire station that's closest to it can get there and save that house before it's destroyed. If you take out 4 of the fire stations and only have 1, some houses are going to burn down. So when we reduce the number of testing sites, some communities are going to get high infection rates. And that's what happens. You can't have one agency testing all of Baton Rouge, and we're not even talking about the rural areas. After Katrina, we're no longer testing in the rural areas. Did they start having sex? No. Are we still testing? Not like we used to.
I have to differ with you there, because Aspiration has continued to do free testing. Not only are we doing free testing, we are providing free tests to other agencies to provide testing. I have a supplier who brings tests to me, and I make sure that those tests get to those agencies that are doing the testing.
That's a really good point, and I have like 2 questions to go with that. First, how do we get more people to want to go out and get tested? I know just speaking with a few people, it's somewhat like they feel like, oh, it's going to happen eventually in some communities. Like, in this thing that's HIV, because it's so treatable now, there's medicines, you can live a normal life right now. I feel like some people, just some people, aren't really putting it at the forefront of what's important. So what do you suggest, or anyone actually, that we increase the intensity of this disease? Like, I know in places like Africa, people have this disease, but it's not comparable here in America because we have so many resources.
Our testing, I want to clarify that. The testing, what we used to have, was regular, ongoing testing, which means that you would have testing in a given community almost every other week. That's the testing we don't have. Okay. I'm not talking about an organization that has a testing event on that day. Isn't that World AIDS Day? Testing. I'm talking about somewhere you know you can go regular and get tested. I'm talking about every other week somebody's coming into this community and doing testing, because that person's mind is like, in our state, it's like 33% of the people that get tested find out they have an AIDS diagnosis within 6 months. It's late testing. So if we increase the regular testing in the community, a person, when we bring our mobile unit to the community, it's like the ice cream truck. We don't need to do outreach and pass out flyers and that. Before we can even set everything up, people sitting in chairs ready to get tested. But that's not happening like it used to.
Yeah. We've talked a bit about testing, but what about the treatment side of this? Dr. Derry, it's more treatable. What about the medications, the availability of medications?
Sure. So oftentimes when I'm interviewed and reporters or whoever will say, well, what happens when somebody tests positive? I go, listen, testing positive, that's not a bad thing, right? I'd rather have HIV than have diabetes or cancer, because diabetes and cancer, those are very unpredictable diseases, right? HIV, if you take your medications regularly, it plots along a very predictable course. So the medications are excellent, and they're available. And yes, I grant you that it's hard to know where the resources are, but once you're absorbed into the system and you're motivated to stay in the system, the medications, we've got some medications down to 1 pill once a day. When I went to medical school, I remember every year we would have folks that were infected with HIV, and this is before the cocktails that we have now that are very elegant. But they would lay out hundreds of pills along the table, and they'd be like, I got to take 12 at 5 in the morning, I have to set my alarm. I got to take 15 with breakfast. At 10 a.m., I got to take another 12 all the way down the line. Now, and those medications were not helping. People were still dying. Right now, medications are incredibly helpful, and people who take their medications regularly, and look around this room, as you will see, live the lifespan of somebody who's not infected with HIV, and it's a very high-quality life.
And the medication has become a yin and a yang as well, because in our community, people are looking at medication and saying, okay, if I get infected, I'm just going to do like that person, or Magic Johnson, or like this person. So since I only have to take 1 pill a day, I ain't going to worry about it. AJ, what you're saying about a condom use, I ain't worried about it, man. I'm going to go ahead and do my thing, because if I get infected, just hook me up with one of those agencies and give me that stuff.
May I go back and answer her question? You asked the question, what do we need to do about bringing HIV to the forefront? I disclosed in church. I disclosed within 4 hours after being diagnosed. I took my message from the pulpit to the public. I went on to the national stage because I thought it was important that people know that AIDS looked like me, because there was a misconception about being HIV positive that if a person had it, you could look at them and tell. I took my message to the public, and I'm out there every day telling somebody that I live with this disease. Not because I wanted to make it look glamorous, but because I wanted it to be reality to someone. There are people in my family that still do not believe that I'm living with AIDS because I don't look sick. we have to dispel that notion. We have to keep it out there. We have to make sure that people know that this is the face of AIDS. That it did not ask me for a resume. You know, I didn't audition for this position, but I'm in it. And we have to make sure that we keep it on the forefront. We're in the rural communities, we're in the street, we're doing this because it's necessary. And we are youth focused because we need to save the lives of the young if we're going to dispel this, get rid of this disease in our lifetime. So we're out there.
Lysandra, you had a question?
I heard you, doctor, say something about for every black male, there's at least 4 women. Is that the reason why that African American women are at a higher risk?
I think so.
Of HIV
I think
and
so,
AIDS?
yes.
Okay.
And that's in affected communities, but and this is my belief.
She just mentioned about focusing on our youth, and I think I'm definitely an advocate for youth and young adult. I definitely want to mention, though, that we have to focus on not just the youth, but all age ranges.
Right.
I mean, the divorce rates are increasing, so you have to think about people who have been married for 20 or 30 years who are getting divorced. So I have a 60 or 70-year-old man who's back on the dating scene.
Right.
He doesn't know how to use a condom, doesn't know anything about STDs or HIV. So we definitely have to let everybody know that it will affect any and everybody.
Well, at Baton Rouge AIDS Society, one of the things from the beginning we've always focused on, and you can't get funding for. You can get funding for crackhead or substance user or high risk multiple sex partners, but people don't want to engage at risk. It's not about high risk. We have always focused on at risk. You're having sex? Yes, at risk. Right now, people are beating down the doors trying to do testing at gay clubs because the funding is the gay club. But we have a lot of other clubs in Baton Rouge besides the same 2 gay clubs. And if you think gay men only go to those clubs, you really don't know nothing about the gay population. So what about the heterosexual clubs? Nobody's pulling up trailers, and that's what we're starting to do now.
So, but there's also an issue, right? And Pastor Smith, if you want to comment on this, one of the issues is that we have a number of men who are having sex with men who don't identify as gay, who also have sex with women and bisexual, and the stigma against that. Is that what is keeping people from getting tested? Is that stigma?
I'm sure that there are several reasons that you can cite for why the continuation of the spread of AIDS and HIV takes place. In response to your question about spreading the word in treatment, I think one of the things that needs to happen is that we need to exercise a little bit of patience with one another. I recognize that this is an urgent matter, and in some people's lives it's a far more urgent matter than others. But education is an incremental process. It does not happen overnight. And getting angry with certain segments of the community because they're not where you are turns what should be allies into foes. And it causes backlash. And in my opinion, that slows the process rather than speeds it up. And so I recognize that first and foremost there is a medical component, but there's also a psychological component, a sociological component, an economic component, and for many people a spiritual component. And it's not just a Christian spiritual component. There are people of various faiths. And I think that some effort needs to be made to try to bring all of these various entities together, and rather than barking at each other or pointing fingers at one another or saying, you haven't done enough, which is only going to raise up people's defense mechanisms, we need to try to find a way to talk cooperatively with one another and say, where do we go from here?
Well, I can. I want to answer the question about the gay men, but I also want to deal with that issue. Gay men in our community it's not stopping men from getting tested. I've been doing this for 18 years. Back in the days, we didn't even see as many African-American gay men. And now African-American gay men are getting tested. So it's not, we test, 30% of people we test are from the gay, lesbian, bi, straight community. So it's not like they're saying, I'm not going to get tested. As a matter of fact, there are some gay communities that they empower new members of that community, if you're going to be part of this community, you have to get tested every year. Now, we do have a separation in our community of the gay population and the men who have sex with men, because men who have sex with men traditionally come from the prison setting, that a man would say, while I was incarcerated, I had sex with a man, but I have sex with women. I'm not gay. Gay men, whether they have sex or not, identify as being gay. So there's a difference in those communities, and the stigma in each don't allow both to always accept each other. Now, Martin Luther King said in his speech about I have a dream, there's a lot that comes before that part of the speech. And he talks about the time to act is now. The days of gradualism is over. We can't take an approach, and you will hear, like from Dr. Keller and I, there's a frustration because we've been doing this. We are not at the liberty or the luxury to take the approach of we will gradually get to this. People are dying every day. If you go to California, you don't have this gradual approach. You go to New York, you don't have this gradual approach. It's not just the churches. Our bus stations need signs on the buses. We need billboards everywhere. We're #1 in the country, and we still wait a gradual approach. You know, if we just wait long enough, it might not be #1 no more. So let's just take a gradual approach. Yes, you're right. In dealing with pastors, it takes a while to get there. But we also have to be realistic and tell them, we ain't got that much time. We need help now. What more is it going to take? And like she was saying earlier, I've been to so many meetings, y'all, with politicians and corporate heads and all these leaders in the community. Talk. Where's the action? What's the plan? What are we going to do next year? We don't have that. And that's what's missing in our community.
Ronnie, you had a question.
Yes, it was a question, but now I'm going to make it a challenge. You know, because you know it has to do with the root of our problem, and that is setting up a dialogue that is acceptable to all clergy. All right, that will enable them to develop a meaningful, substantiated plan of action to combat the education and the prevention of HIV. I say that in the sense that I myself have tried to, I put together a informational pamphlet type deal, and I hand walked them to some of the larger churches, the Presbyterian, the Methodist, the Episcopalian. Well, I was stopped at the door and asked, what do I want? Mm-hmm. And I tried to explain to them that it's difficult to get to see you all unless you know somebody. And that's not how it's supposed to be. Mm-hmm. I should have been accepted and invited in to at least hear me. Some of them accepted the material. Some of them, blew me off. And these were, past. All I'm saying is that you are in a position to, let's say, pull together the Baptists, the Methodists, the Christians, the Episcopalians, all right, the Catholics, and they all need to get together and develop some type of dialogue that they can implement a program of informing people of the danger, because this is an epidemic. So as I say, it's a challenge. I challenge you to call together my pastor.
So how do you respond to the challenge?
Well, my first response is to say that while I appreciate your point of view, I think that you're overlooking several difficulties in what you're suggesting. I recognize that this is a serious, urgent matter that needs to be discussed. But you're talking about theological differences that exist not only within various denominations of Christianity, but within various churches within single denominations. When you say pull everybody together, you have no idea how monumental a task
that is.
Oh, yes. Oh, yes.
It's extremely difficult. Not that it's not worth the effort, but I'm sure that you can understand how frustrating it can be to try to bring people of various theological perspectives together, various levels of education, various levels of exposure, various levels of security. And when I say security, pastors of certain African American churches have to think about their own job security in talking about these issues.
Yeah, that's
and bringing these issues to the forefront. I understand your frustration, and I'm not saying that it's not worth doing. I'm saying when you say just pull them together,
Ronnie,
it's a far more difficult task than what you might imagine.
I want to say this though. The same thing I say about testing, and the community needs to know. If you don't know your current HIV status, you are part of the problem.
That's right.
And so the pastors out there, instead of saying this global attempt, if a pastor out there that's listening to this program does not have an HIV program at his church, his church is part of the problem. We're not going to say, look, grab all these churches together. What are you doing at your church? We started Real Life Ministries because I got tired of going to different churches waiting for people. We got to do it every Sunday or as much as possible.
Charlotte's been waiting to get a question in, and
Actually, I don't have a question, but I do have I agree with Pastor Smith in that we do have so many different opinions and among pastors concerning what we say in the congregation among people. We are worried about offending our fellow pastors and deacons and all those other things in the church. And so, yes, the pastor is the leader of the church, whoever that person is, that clergyman or whoever is in charge of that congregation. But at the same time, what we need to do is get to that person and who has the influence to be able to connect to the other persons in that church so that we can talk about and discuss how we're going to approach this congregation.
Right. We need some final words, so we'll start at the end and work our way across.
I appreciate being invited to this forum, and I want to give my personal pledge that if there's any way that I can serve to make AIDS awareness better in the Baton Rouge community and beyond, I'm willing to do that.
Thank you for inviting me. Thank you. I've enjoyed this. It's been a very heartfelt and passionate conversation. It's one that I feel very passionate about. My final words are that it's time for there to be universal testing. This needs to be offered for free. It needs to be offered every year. We need to encourage our local government, okay? We need to encourage the folks here in Baton Rouge, the lawmakers, because, Ms. Charlotte, I did go to the lawmakers. I gave them the numbers, and they completely blew me off. They chose to believe the woman who came up behind me and said that if we have comprehensive sexuality education in the state of Louisiana, it's going to lead to sex slavery. That's a lie. Abstinence only is a lie. We have the numbers. We Bobby Jindal sent down one of his guys to look at the subcommittee on education, and he made a point of saying, oh, we just need to take more time to study this in the state of Louisiana. I had the numbers. They're not listening. We need to remove the stigma associated with HIV.
Right.
We need to talk about it more often. We need to have more forums like this so that you can see the passion that's up here, so we can hear from you guys. We can exchange and dialogue. Education and testing, that's what we need to do. Thanks for having me, guys.
Well, my final words are, rather than dealing with the numbers, I think we need to deal with individuals. My final word is that I will continue to make AIDS personal, because everybody who knows me knows someone who's living with this disease. And everybody is affected because I'm infected. And I will continue to be the face of AIDS in Baton Rouge and across the country. And I'll continue to be that, because we have to remove the shame, the blame, and the stigma attached to this disease. So I will continue to be the person who addresses this issue as a human being and as an individual living with it. I'm not a statistic. I'm a person. This is a human issue, and it is not one of shame.
Well, I just want to thank God, first of all, for this opportunity that we could gather and talk about this. And it needs to happen on a regular basis. Louisiana Public Broadcast has said, let's do this. And it's not the first time they've talked about HIV. Every TV station should be doing something like this to catch as many people in our community as possible. We have to start talking about it. We have to use proper condom use. We have to increase testing in our community. We have to start getting involved in our community. We're not doing those things. We keep sweeping it under the carpet and just pray to God it doesn't stay dust. It just turns into something else. I have this wristband on that says, we are greater than AIDS. If we believe that our community is greater than AIDS, that God can change anything, then we need to be saying, order our steps. The Bible says, lean not unto thy own understanding. We got to stop thinking that if you don't feel nothing, you don't have nothing. You can have it over 20 years and not know it and continue to spread the virus. So education is the key. And for all those churches out there, if they don't have literature, Baton Rouge AIDS Society provides free literature through the Office of Public Health, as much as you could take and disseminate. We got to get the word out there.
We've run out of time for our question and answer segment. We'd like to thank our panelists, Reverend Smith, Dr. Derry, Dr. Keller, and Reverend Johnson for their insight on this month's topic. When we come back, we'll have a few closing comments.
Well, Kirby, that was certainly a very passionate conversation. We could have gone on a long time.
The conversation just started here. I think there's a lot more to say.
Absolutely. And we'll be following this story. We won't let it go away. Well, that's all the time we have for this edition of Louisiana Public Square. We encourage you to visit our website at lpb.org/public square. While you're there, take this month's survey, view extended interview clips, and volunteer to be on the show. You can also comment on tonight's program. We'd love to hear from you, like we did last month following Newtown, a Louisiana perspective. Chris wrote to us, I do not believe the framers of America's Constitution felt someone's right to target shoot with this kind of weapon outweighs public safety issues. Frank D. writes, statistically, doctors are approximately 9,000 times more dangerous than gun owners. And Average Joe writes, the real problem with all these shootings is that mental illness in these kids has not been detected and treated in a timely fashion. Thanks to everyone commenting. LPB will continue to keep you informed on this national debate.
To create a more attractive business climate for the state, Governor Jindal is proposing Louisiana eliminate its personal and corporate income taxes. What would these changes mean for Louisiana's families, businesses, and its bottom line? Join us next month on Louisiana Public Square as we look for answers on Louisiana Tax Reform 2013. Thanks for watching, and good night.
Good night, everyone. Thank you. Thank you.
For a copy of this program, call 1-800-973-7246 or go online to www.lpb.org.
Support for this program is provided by the Foundation for Excellence in Louisiana Public Broadcasting.